Now that we have discussed how to classify asthma severity, how to manage chronic asthma with the use of stepwise therapy, and how to diagnose and manage acute asthma exacerbations, we will now finish our discussion here on asthma with a discussion of AERD, which is a mnemonic for aspirin exacerbated respiratory disease. In AERD, our classic triad is going to be severe late onset asthma, and I emphasize here late onset asthma as these patients tend to present in their teens and their 20s rather than during childhood. Additionally, these patients will present with wheezing and nasal congestion, which tends to occur after using NSAIDs or aspirin, and it is important to emphasize here that although this disease is named aspirin exacerbated respiratory disease, that NSAIDs can also ultimately set off these symptoms. The third component of the classic triad in AERD is chronic rhinocytositis with nasal polyposis. And we have an example here of a nasal polyp in this patient, and this is absolutely classic for AERD. The pathophysiology of AERD, which underlies these symptoms in response to aspirin or NSAIDs, is overproduction of leukotrienes in these patients, and the level of leukotrienes is further increased by aspirin and NSAIDs, thus resulting in wheezing as well as an increase in rhinocytositis in these patients. Given the classic presentation of this disorder, this can be diagnosed clinically. Management for AERD includes the use of bronchodilators, including beta-2 agonists such as albuterol. These patients may also benefit from intranasal corticosteroids as well as saline, as this can be helpful with the rhinosinusitis. And additionally, because the underlying pathophysiology of this disease is an overproduction of leukotrienes, these patients can also benefit from the use of leukotriene inhibitors, such as montelukast. And of course, as one would expect, these patients should also try to avoid the use of NSAIDs as well as aspirin, as this can ultimately set off their symptoms.